Good morning from Circuit World. This is Ask the Doc.
Believe this guy?
All right.
I paused. I left. I can't. I tell you what. You can't leave a pause with Dr. William Whaley.
You snooze, you lose.
Yes, sir.
And look at the tie.
The golf clubs are out.
Everybody knows that Dr. Whaley practices medicine at 81 years old because I don't fly fish and I'm a lousy golfer. And I play golf 7 times a year. So this Sunday, going to be 0% chance of rain. I ain't going to play in the rain. It's going to be 65 degrees in the mountains. I don't play if it's below 60. So my wife and I will play 9 holes badly on Sunday.
9 badly, right?
Badly, very badly.
Good.
And that's the spring in the mountains. Now, people move up here. They say, I want a place that has 4 seasons, but I don't want to be too cold. I don't want to be too hot. 2 days ago, it was 26 degrees on my porch. It's going to be 70-something today in bright sunshine. And this is the place to live. Absolutely.
So
and
are you
if
telling
you come in here, you can buy that big television. But go ahead.
Are you telling me if you could fly fish and play golf, you may not practice medicine?
I don't like to fly fish.
But if you could.
No, if I could, I could fly fish. My brother's
you wouldn't
world
practice
famous.
Anymore? See, I don't believe
hey,
that.
I don't either.
Only thing I can say.
When will he stop?
Yeah,
That's the question of the day.
He won't.
There you go.
So,
Got it.
All right.
There'll be people at his gravestone asking for advice. Listen, the nice thing about golf is it's social distancing's already in there.
Yeah, right. And you're outside in the sunshine.
Well, yeah, when you're out in the woods looking for your golf ball, it's great distance.
And not only that, we got the truck here from Circuit World blocking out the sunshine, so we didn't have to move the truck after we started. Okay.
Oh, by the way, it is time for Ask the Doc with Dr. William Whaley and Dr. Raymond Tidman. We always want to thank Georgia Cancer Specialist affiliated with Northside Hospital. We appreciate you so much for this segment. Dr. Whaley, how are you today?
I'm good. I'm good. Now we got to get into the questions now, because we got stuff coming up here. You ready?
Yes.
This is one of the best questions that we've ever had written here because it is going to uncover one of these great conspiracies that I think is bad about medicine and bad about law and bad about cable television. How'd you like that, cable television?
Yes.
My wife, who is 46 and in excellent health, had an augmentation breast operation 25 years ago. She recently had an abnormal mammogram showing a leak and a knot in her armpit on the same side. That lump is lymphoma cancer, and I went online and found that breast implants can cause lymphoma cancer. Did the surgeon or the implant company do something wrong, or should they have told us to do something? What are your thoughts? Now, the first thing I think about is when you watch television and you see Monsanto and what's that stuff, Roundup, or these different things called 1-800-LAW-NEED or something or other. There have been tons of these ads on TV about the breast implant lymphoma. There are 35 million women in the world who have had a breast implant. You ready? How many have had breast cancer from the lymphoma? 733 out of 30 million. And the kind of breast cancer
I see a pattern there, Bill.
You do? Yeah. Another one. Anyhow, so the answer to the question
is... Who are you, Ed McMahon?
Yeah.
I mean, that's generational. We'll explain later.
Yeah, all right. So basically, at the end of the day, you're really happy that your wife got the mammogram. Because I'm going to show you in the news thing when we get here today about the low number of mammograms and how many breast cancers there are. Because mammograms do look at the armpit, and a lot of lymphoma is diagnosed because the patient got a mammogram. Let's show that first thing about breast implant risks. This is a legal group who says once this thing got the breast implants that might cause cancer. If you've ever had lowered self-esteem, suicidal thoughts, fatigue, trouble, just pull it off now. Everybody in this room's had backache, been fatigued and everything else. these law firms would bring this stuff together and put lawsuits out against the implant manufacturer. You with me?
Mm-hmm.
The truth of the matter is that one implant made by Allergan, they make contact lenses, that had texture over it. They used to be smooth, then they had little hatches over them. That one implant has been associated with about 620 of the 700 known cases of this lymphoma that's associated with breast cancer. Show that next one. The lymphoma that's caused there is called anaplastic large cell lymphoma. You don't care, but anaplastic is a bad sounding word. But it's not a bad sounding cancer. So really what that is, this is a lateral view of an implant. Now, so many patients in our offices have had implants. A decade or 2 decades after the implant is put up, if there is fluid around the implant that they call a seroma, that is an unusual finding. That usually is sometime in the first year after the surgery that there's some fluid around there. And when they go in to replace the implant, that fluid will have these lymphoma cells in there. This is an extremely rare cancer, 733 in all recorded history. 30 or more million women is in that group, and this has a really good prognosis. Okay, show that next one. This is one of those lump in the armpit public service things. Lymphoma, women shave their arm, under their arms, right? You can pull that down now. Women shave under their arms. And so this was to encourage women when they're shaving under their arms to mash under their arms. Just like men get these public health things about check your testicles. You know, this is part of breast examination. And show that next one. This next one is a rash under the arm, and that rash under the arm is associated with this type of lymphoma. Not the breast implant lymphoma, the type of lymphoma that this lady has. And this rash right here looks exactly like the rash that they showed the pictures of in the last few days, quote, associated with the COVID vaccine. Now, how many of those rashes have there been in the COVID vaccine?
I'm not for sure.
12. How many people have had the Moderna vaccine? Well, I'd say 30 million had breast implants. Probably 50 million have had the Moderna vaccine. So anyway, can't lose any sleep over the skin rash. So to finish this guy's question, one, no, the implant company the surgeon didn't do anything wrong. If after 2019, your wife had an Allergan implant and you don't know that, then there would have been a recall of all Allergan implants, and the company then, you're supposed to have it. Yeah, you got it removed for free and replaced. But they not only did that, they recalled every other type of device they'd made with silicon in the whole world. They did everything in their power to relieve people's mind. And yes, this was a long-term effect that you could never figure it out. It doesn't occur until 10 or 15 years after the implant. So all the clinical trials never showed any problem. So the company did nothing wrong, and they're going to end up like all the rest of these companies paying tens of millions of dollars just to make the lawyers happy.
Well, the operative word there, Bill, is cause. There is absolutely no causal relationship that's been demonstrated.
Correct.
It's an association that lets some ambulance-chasing lawyers, if I may say, make a lot of money and buy sports stadiums.
That's right. And the other thing is that business, then that's where all this stuff about the fatigue came from, because it's an autoimmune process, and then you got what's that thing everybody has, fibromyalgia and all that. Yeah, every symptom. Everybody's got those symptoms. So they're trying to take all of these symptoms and make it where you can sue the companies. Doesn't make me happy. So nobody did anything wrong. You're lucky your wife got the mammogram. That was appropriate. The fact that she has a low-grade lymphoma in her armpit that wasn't making her sick, I'm glad you got that diagnosed. It's got a good outcome, and there's nobody to sue here, and your wife got good care. So that's the end of that one.
Okay. All right.
What do you think about that? I mean, we attacked the lawyers, didn't we?
Oh no, I have to be careful. I have to be.
Oh,
I,
excuse me. No,
I,
wait a
I
minute.
have to be careful with that.
Oh, that's right. Wait a minute. We told Northside we'd have no politics on this program.
Yeah,
Okay,
right.
no politics.
That's not political.
Huh?
That's not political.
Well, you never know. You could have an attorney in the family. You just want to be cautious, okay?
My mother's a lawyer, my father's a lawyer, and all three of my brothers are lawyers.
Oh, so okay.
Yeah, okay, go ahead. Let's go. All right.
Most of them have a good sense of humor.
Do
Yeah.
they? Most
I
of-
forgot that one about you had a joke about lawyers a few years ago. Okay,
All right.
The
let's-
second one here is an outgrowth of a one we had a couple of weeks ago about organ preservation, and I think this is kind of important. My husband has a new cancer of the throat in some place I have never heard of called the epiglottis. What's the epiglottis? You don't want.
I never. I never heard of it.
Oh, good. All right. Well, I didn't want to put.
Cartoons.
It's in the cartoon.
It's in the cartoons. All right. The surgeon is talking about a huge operation that will remove his voice box and cut up both sides of his neck and require skin grafts. Now, so the epiglottis, I'll show a picture of it in a minute. Never mind. You talked about bladder cancer and organ preservation a few weeks ago. You remember that one? Well, where the guy was trying to save his bladder? Do we have any options? Okay, well, she didn't stop there. She gave you some more info. He's 76 years old, and he's had a heart bypass and has stents and a pacemaker. But he's very active, plays golf and pickleball. So what we have is a senior citizen who has had great heart care because he's still able to play pickleball and able to play golf, and he's got a battery-powered heart machine in here and a couple of pipes making the blood flow. If you did this operation, he'd be out of whack for 6 months. With that kind of heart, you'd probably kill him. Show that first picture there. We won't stick with this very long, but here's it's much bigger on there. Here's a side view of the throat, okay? And talks about symptoms and everything. But when you swallow, you remember, you've got a swallow tube and a breathing tube side by side.
Right.
So when you swallow, why does that cup of coffee not go down in your lungs? I mean, the two holes are right side by side. Do you know why it doesn't go down in your lungs?
Epiglottis.
The epiglottis falls over the esophagus and falls over the trachea and blocks it so that the coffee can go down your esophagus. So that epiglottis sits right above the vocal cord. So it's all part of the larynx. You've heard of the larynx before, but the epiglottis is part of the larynx. So anyway, pull that thing down now. Organ preservation. The goal when you are trying to do anything in medicine is take a hazard benefit ratio and put it on the side of causing the least problems that you can cause that will have equal effect of cure and control. So like blood pressure, lose 50 pounds and don't take and cut down on your salt before you take a pill that might make you get lightheaded when you stand up. I mean, simple. Diabetes, lose 50 pounds and watch your diet before you have to take insulin. So you can pull that thing down. So when in doubt, cut it out is a surgical mantra into a hammer, everything's a nail. And I don't know the extent of this man's disease. If it's very early on if it was very early on the larynx, they could go in there and sort of do a face peel like we do on our skin. But I've never seen personally an epiglottic tumor that was treated in that fashion. So the answer would be go to the next one. And this tells you, this is one of these little charts that tells you that, you can pull that down, it's too complicated. But the control, meaning the survival and the local recurrence rate, is equal with the chemo and radiation therapy as it is with the huge operation, just like in that bladder patient. So for at least the next 10 years, with chemo radiation therapy, assuming that he probably has lymph nodes or a pretty good sized tumor in there, he will have the same survival and cure rate as he would with his major operation that would take out his larynx. He'd have to learn how to talk with esophageal speech or have one of those things he puts up against his neck. they take out all the lymph nodes on both sides of the neck, and when they take out the larynx, they're going to have to make some skin graft to cover up that big hole, and that's going to be a mess. Well, God's 76 years old. 10 or 15 years from now is going to be 91.
Yeah.
So
I'd be shaking my head at this. I mean, you're talking about giving up two major pleasures of life. Okay? His communication is gone. I mean, he's going to have to learn how to communicate. So he's not speaking to people. That's isolating. His ability to eat is gone.
Yeah.
So that, I mean, this is, I mean, just functionally a no-go situation.
Yeah, right. So anyway, once again, organ preservation is a concept that we try to stick with as much as we can if we get equal results. Now, the one that has the best track record and everybody knows about it is that we almost never take the breast off anymore. You know, it's lumpectomy and radiation and preserve the breast. So anyhow, I think you did. Yes, your husband has some options. I think you need to go to one of these, you know, north side, go to Piedmont, go to some place that's got a bimodality group, because you're going to have a radiation therapist, a medical oncologist, and a surgeon get together and talk about your husband and what's going to be best for him. That's what we talked about with the bladder. I think it was 3 or 4 weeks ago. All right, so that gets us to there. Now, as I told Ray when we started, that armpit rash gets us into the COVID conversation, because that has been the hot topic on the news here for about the last week of what's this big rash. So here you go, latest health news. Pop that big old boy up there. And it's about the fourth on the list. Nope, fourth on the list is skipping mammograms raises the odds for breast cancer. We beat that to death last week. And then the next one is skin rash with the COVID vaccine. So I'm going to shut up, and Ray's going to take the ball here and run.
Okay, we're going to segue. That's a segue in, but first I want to thank you for your questions out there. You can always send questions to Dr. Whaley a couple different ways. Info at FetchYourNews.com. Put in there, ask the doc with your question, and also follow us on social media, all of our social media, Facebook, Instagram, and find us there. You can send us questions that way. We always want to thank Georgia Cancer Specialist affiliated with Northside Hospital for the segment.
I don't know much about social media.
You know,
is that FaceTime thing where you?
Yeah, you can Facebook.
Facebook, okay, all right.
Facebook, okay.
And that's Flitter and Twitter too, right?
Twitter, yes,
okay.
The works.
The president, Twitter.
Yeah, okay. You know, I feel like, let me just say this, okay? I hear follow the science so much. I feel like I could find science walking down the road, and I need to follow it. Just don't need to know where the science is going. I just need to follow it because I keep being told. I don't know.
No, you know, that's I love that lead in. A lot of people know that I was an engineering student before I was.
No, I told him you were.
Medicine.
I told him that you were
aerospace
rocket scientist.
So you know, so I had the honor of being around these incredibly brilliant professors who designed helicopter blades and did the metallurgy to make sure these things didn't fly apart when they were going faster than the speed of sound. That's some real science. Okay? This nonsense on TV is not science. So let me get into this for a minute. First thing I want to do is if you got a friend in the CDC, send them this statement right here. We are not herd animals. We are not herd animals.
You sure?
Absolutely certain. Okay? And one of the things, the beauty of our profession is that we treat people one at a time. Bill's constantly talking about the nuances of a case that's very specific to a person. Okay? So the beauty of good medicine is that people have a good relationship with their physician, and they come in and they get their questions challenged to the doctor, and he goes around and gets the research and talks to the other folks and pulls it all together and says, this is the plan, let's do it. He doesn't treat everybody like a herd. And you're constantly hearing more and more now, and you have this kind of blow up that's occurring in the COVID discussions, that when are we going to reach herd immunity? Well, it doesn't matter to me. They're not running around checking antibodies and thousands of people, seeing if they've got that certain percentage that's magically thrown around out there that's anywhere from 55% to 75%, which is a big range, to say, okay, well, you guys have herd immunity, you can calm down now. Things don't work that way. We have functionally the numbers all going in the right direction. We have functionally the people that are most at risk getting their vaccines and protecting them. And we have more and more people saying, we got to open up, we got to get back to life. So we're there. And if I could do anything to get people to settle down and get back to their lives and do, like, I don't want to raha certain states, but there are certain states where they're saying, look, enough of this. We got to move on. So I wanted to put that picture, and we kind of talked about this early on in the COVID discussions. If you wanted to pick an environment to avoid versus an environment to get to, knowing those two environments is, and you're always going to be somewhere in between, tells you whether you are being a good COVID avoidant person or someone who's getting into trouble. Okay, and this came out in April in the military studies, the biological labs in Maryland. What kills COVID? Sunlight. 90 seconds of sunlight in 70-degree temperature.
How about 65? It's going to be 65.
And proper humidity. Okay, so anywhere where that's happening, sunlight, good temperature, good humidity, COVID's dirt. I mean, it's just gone. Now, if you're in a room with no circulating air, it's warm, 70 degrees, and dry because you're heating up that cold air, bringing it in, so it's at 20. What's the half-life of a COVID virus? 18 hours. 90 seconds, 18 hours.
You don't want to be in a bar with a bunch of guys from Florida, right?
Or a subway in New York, or a tenement house in somewhere where you've got steam heat and no air blowing around. Okay, that's COVID death. Go to the beach, go outside, play golf, do sports. As I said from the very beginning, stay alive, go outside. Okay. Now, anybody that you hear saying the opposite of that, they absolutely, I mean, it's the opposite of that is bad advice. It's malpractice in my world. And I went on the CDC website yesterday, and they have, because I happen to be going on vacation again to a very nice place, they have certain islands in the Caribbean marked as no-go zones. Don't go there, okay? And I'm like, what science is that based on? Who in the world came up with this idea that being in warm weather with a breeze and humidity and sunshine is a no-go place? I have no idea where that's coming from.
It's coming from those tenements where those people are living close together and they've got a lot of COVID vaccine, but I guarantee you at the Four Seasons with the golf course or out there on the boat, that's not the island.
No, it's not the island. Not the island, and it's well-to-do people who've gotten their vaccine and gone down there. But the people that are vacating or getting away and enjoying themselves are also not stuck in poverty, waiting for somebody to come spend some money so that they can get a life back. So, I mean, there are all these secondary things that are going on that harm each other, and that's why I keep coming back to we're not herd animals. And I feel like it was a very wrong thing for our profession to hand that baton or whatever you want to call it over to anyone to say that our profession can tell politicians how to treat people like a herd.
Yeah, let me stop that there. I'm going to pull this mask out for a minute because we do have pipelines to what goes on in the scientific community and in the CDC. And I guarantee you within 4 to 8 weeks, the CDC is going to come out with a guideline that we brought up here about 3 weeks ago when the vaccine was ramping up, about when you've had 2 doses of the vaccine, what can you do differently? Well, when you listen to the news today, it's nothing. They tell you got to wear the mask, got to wash your hands, and so forth. They don't tell you that let's just make the assumption that Dr. and Mrs. Tidman have both had their COVID vaccines, and Dr. Whaley and Mrs. Whaley have had their COVID vaccines, and Dr. and Mrs. Rarick have had their COVID vaccines, and they're all 2 weeks past the last visit. They can go home and play bridge and have barbecue at the house and everything else and throw the mask put the mask on the table. But that's not what they said on
That's not what you're
TV
hearing on
yesterday.
TV.
The president said yesterday, you got to keep wearing your mask. Didn't say you got to keep wearing your mask when you leave the house and go to the 7-Eleven. Said you got to keep wearing your mask and wash your hands. We can be together now with people that have had the vaccine safely, as long as a pizza delivery boy doesn't come in there in the middle. Of course, it wouldn't bother us anyway, but if we were in that place with the elderly that haven't been vaccinated, then we don't want the pizza boy to come in there. So anyhow, you won't hear this for 2 months.
No, you won't, and and that's why one of the reasons why I wanted to take the time to talk about this. I mean, it's human nature. I mean, every year we have flu vaccines, and we encourage people to come and get the flu vaccine, and people are naturally worried about having something put in their body. Okay. But over the years, enough people see people getting flu vaccines and not get sick, they say, well, you know what, maybe I can get the flu vaccine. They see others doing something, and by example, they say, I'm okay. You come out with a brand new vaccine that all kinds of yahoos on the internet have said is, control your mind and change your DNA, and they whip up all this fear. It's going to be hard to get people to take that vaccine. Plus, they have no experience of seeing other people who've had the vaccine and been okay. And then add on top of that, the CDC coming out, well, it don't matter anyway, you're going to have to wear your mask, and you're going to have to hide, and you're going to have to keep your distance.
Right.
And I mean, it's the negative marketing going around this is ridiculous. So Bill and I are encouraging, at the end of the day, into this conversation, identify if you're at risk. We've been saying this all along. Take the smart actions to avoid getting caught in it. Wear an N95 mask when you're in public or around people you don't know, and get the vaccine. If you don't get the vaccine, then I would add one other thing. Think about getting the lateral flow home test COVID thing, and make sure those around you and you yourself, if you have any symptoms at all, you test at home and immediately, within 15 minutes, know whether the virus is around you, okay? And then take the appropriate action.
Get the vaccines a lot cheaper.
Get the vaccines a lot easier.
It's free.
Yeah, and it's free to use. So.
Well, let me say this, because I mean, you're right. I mean, this segment here, we want to make sure we don't have. We don't come in a direction of a political tone, but the government is so involved with the distribution of the vaccine, regulations, and CDC that we have no choice but to talk about some things. So let me say this. This past week, Governor of Mississippi and Governor of Texas said...
So when you say government,
government.
So but you're talking about, when you say government, I'm thinking about the local sheriff all the way up. I don't see anybody trying to tell everybody what to do that's not up there in Washington, to be honest with you, or in New York.
Local folks are smart about this.
Yeah, because I think the New York guy did the right thing. The Mississippi guy did the right thing. I mean, the New York City, even they opened up. I went to restaurants in New York City this weekend when I was there, in the restaurant. So people are doing the right thing in spite of Napoleon Fauci and the president telling you to lock down. I mean,
you're right there.
I went from a deplorable to a Neanderthal. From deplorable to Neanderthal. But anyway.
All right. Well, Neanderthal. That we were going to. All right, we'll go there. But no, the governor of Texas, and we have conflicting information. The people out there. I mean, sometimes you wonder, what do you believe? Because the governor of Texas, governor of Mississippi said, we're open, 100%. I mean, we're open 100%. Everything's been lifted. Then you have Alabama football saying, we're open this year, this upcoming football season. We're selling 100,000 tickets. We're open. And then you have some in the cable news networks with professionals out there saying, "Oh, it's way too early to react that way. Triple layer mask, and here's the one." and this is what I'm hearing is prepping us for COVID spike number 4. So there's a lot of people, we don't know what to think. Are we out of the woods? Are we getting out of the woods?
No, those people need to powder their nose. Okay, I mean it's just not happening. We've got the vaccine now. We've learned our lesson. This isolation thing, I think we'll look back 10, 20 years from now and say this economic isolation and shutdown was the worst thing that you could have possibly done with this thing. And you know what the best thing that you could have possibly done? is get a vaccine out as quick as possible and get it in people's arms.
All right, now I want to say something because this is not a conflict in fact. It's that we don't know next week what we don't know today what we're going to know next week. Now, you remember that probably 3 months ago, I was touting the use of BAM, the antibody for people that had the COVID virus immediately upon diagnosis as an outpatient to diminish the chances that they'd end up getting hospitalized. It actually did that, but the next study of using the antibody in a certain fashion turned out not to work. Well, it's like what we learned with hydroxychloroquine or with other things. So we study it pretty well, then we get some clinical trials and we say, okay, it's really not working. So I believe that the evidence is out there that the vaccine, 2 doses of it, at least for 3 to 6 months, is going to protect you. We might learn now in October that there's going to have to be a booster shot. Well, that doesn't mean that we made a mistake up here. That means that just like this breast implant thing, it took 10, 12 years, 15 years for this to develop. So we're going to learn more things as time goes on. And I'm not going to say that we failed if in September or October they say, I think you're going to need a vaccine, a booster that's going to have a little different formula. I'll say, fine, we really learned a lot more. And everybody else is going to say, well, you failed. I told you in the first place that vaccine wasn't doing anything. So we're going to learn more. But right now, what we know is open up, and Texas did the right thing. Now, the governor, they pilloried that governor, but if you listen to everything in his statement was that we open up. We want the people that are over age 65 and with comorbid conditions to continue to protect themselves. He said that when he said we're opening up. We're opening up for her and you to go out to eat, not your 75-year-old aunt who has not been immunized. If your 75-year-old aunt has had both her injections and 3 weeks later, take her out to eat with you.
Well, wait a minute. Here's a novel thought. No, maybe he's allowing you to make your own decision.
Make your own decisions. And that brings me back to the first thing I said. We are not herd animals, okay? And you got one group of people trying to steer you like you're a herd animal, and then you got some other people saying, we're Americans, we're free people. Be smart. Figure out what's at risk for you and take care of yourself and ask the right questions. We are not herd animals.
Okay.
Are you sure?
I'm pretty damn sure.
All right. Now,
one more thing.
Yeah, what else?
Then we got to wrap this up.
Why is that?
I don't know. We just do. Are
we wrapping it up for the 2 dogs?
Rick over there is making faces and everything.
We wrapping it up for the...
He's got signs saying wrap it up and everything over there.
We got 2 puppies coming, right?
Yes.
Oh, my goodness.
Pet of the Week's going to have 2 puppies.
No, we do. We have Pet of the Week, too.
2 puppies.
Okay, don't lose my train of thought. You know how easy that is. Okay, so...
Very easy to get
another
you off.
thing we're out there thinking, and then what I try to bring is some of the things I hear throughout the week. And I think people out here, we get confusing information. So right now we have a Pfizer vaccine. It's a 2-dose system. We have Moderna's vaccine as a 2-dose system. This past week, Johnson & Johnson with a 1-dose vaccine came out. So answer my question. I'll say it to me. Let's say they say now, okay, my age, you're ready to go get the vaccine. And I say, okay, I'm going to go over to my local pharmacy and get the vaccine. What do you have? Well, we don't have Moderna. We don't have Pfizer. We have Johnson & Johnson. Do I say wait for this one, or do I go?
Supplies are limited. Get the next one.
I'm going to tell you that listen. If you're trying to get a flight down to Miami for the, when the ice storm's coming, you don't care whether it's on Delta, or Eastern, or TWA. You take the first flight you can get out of here, right? You take the first vaccine that you can get. Now, I am going to say that if you're over 65, I would tell you to try and get the 2-shot vaccines.
Okay.
If you're under 50 or 60, then I think the 1-shot vaccine is probably just as good. But you take whatever you can get.
I will say this: somebody, and I don't remember who said it, and I don't want to say quote, but the way I remember, somebody said this week, the Johnson & Johnson vaccine will keep you out of the ICU and keep you out of the morgue.
Yeah.
So,
Yeah,
I mean,
right.
that's what it was.
That's basically true. And it is less effective. And I've repeatedly said this, that we've always thought the flu vaccine was great, and it's never been better than 65%. And when we had a 95% for the Johnson & Johnson and the Moderna, everybody got thinking that was
Cat's meow.
that was what you had to have. When they put this proposal out to make vaccines, it was 50% they were trying to hit. So 65% is way above it. And that 35% that get it aren't going to get it like they would have gotten it if they hadn't had it. Just like that 1 out of 20 who had the Pfizer or the Moderna. When they get it, they don't end up in ICU or dead. So that's exactly right. It'll keep you out of the ICU.
Let me ask this one more question, because this is another one I've heard a couple people say. Okay, so just I don't want to get the numbers wrong. We'll just use a percent that I've heard once or twice. So let's say 30% of Americans have had COVID. Let's say 30% have had COVID.
Have had contact with or been exposed to COVID.
Okay.
Oh, actually,
All
have had COVID's 12.
12. All right. So we'll say that. Okay. All right. And now we have everybody vaccinated. We get everybody vaccinated that is in the high risk categories.
Okay.
That's another 20% of the population.
Okay. I've heard some people say, okay, then why do I need to take the vaccine?
Because we have people in our community who are younger than you that have died from from COVID. They are not a lot, but they are people. Oh, by the way, the 3 countries in the world with the highest death rate are the United States, Great Britain, and Italy, and they were, I think, Italy, and they're the 3 countries with the highest percentage of people that are considered to be obese. So, weight
And elderly.
Well, yeah, but wait. If you got
That's a big issue.
once you drop
issue?
out elderly, I'm going to get down into less than elderly. The guys that have died that are 20s are those guys that are 280 pounds. So it's obesity. I mean, if you don't have diabetes and lung disease, but if you're just talking about risk factors after age, it's generally obesity. And this country's obese. So
And
that's
the only
reason
patient
you
I've
get your
lost
shot.
was a very obese patient.
You have something you want to close with?
Well,
or something?
my grandson's in a serious one-liner for you. You ready?
Yes.
What did one hat say to the other?
Okay.
I'm going to go on ahead.
I love that.
Okay.
What
all
one
right,
hat say to the other, I'm going to go on ahead. I love that.
All right,
Okay.
I've got to put.
Keep bringing those.
I
Those are my favorites.
want to put to death one bad myth I've heard a lot this past week, and that is that somebody on some talking head said that during the flu epidemic of 1918-19, that people didn't die of influenza, they died of bacterial pneumonia, and it was the mask that gave it to them. And that people who are dying of COVID are dying of bacterial pneumonia, not COVID. The truth is that, yeah, when you get really bad flu or COVID pneumonia and you got a bunch of fluid in there, you can get bacteria in it. It's like if you skin your knee and it gets all that goo on it, then it gets infection on it. Well, the infection wasn't what you got from skin, it was from the goo. So the bacterial pneumonia thing is the most fallacious argument I've heard against wearing the mask and the fact that we're really not dying of COVID, we're dying of bacterial pneumonia. And whatever talking head on television said that, I don't know. But he did it enough to where people are talking about it, it's in social media, whatever that is. That's what I'm closing with.
All right. Hey, I tell you what, thanks a lot, doctors, Dr. Raymond Tidman, Dr. William Whaley. We appreciate you very much. Don't forget, you can always share this with your friends. You can go to FYNTV.com. Right at the top there, it says Ask the Doc. It says Ask the Doc, and you can check out, actually, we have Northside's logo up there. You can link right to their information. But anyhow, Ask the Doc, all the segments are there, FYNTV.com. And we want to thank Georgia Cancer Specialists affiliated with Northside Hospital for the segment. Share it with your family and friends. Great information these guys bring every week. And you can send your questions, info at FetchYourNews.com. Put in there, Ask the Doc, or on social media. So we're going to take a brief break, and then it'll be time for the All-Star Political Panel.